Welcome to our presentation on the pathway of a red blood cell. We're going to look at pulmonary and systemic circulation. We'll start off with erythropoiesis. This is the formation of red blood cells. It happens in the bone marrow of long bones. It has to happen because unlike other cells, the red blood cells don't just divide when they get old, they die and they have to be replaced. So when the kidney senses that there aren't enough red blood cells in the body, it secretes a hormone called erythropoietin, which travels to the bone marrow, stimulating red blood cell production. Now we'll look at pulmonary circulation. So this is the movement of deoxygenated blood to the lungs to become oxygenated, and then it's returned to the heart. So step 1, blood arrives via the superior and the inferior vena cava into the right atrium. The right atrium contracts, pushing blood through the tricuspid valve to the right ventricle. The right ventricle then contracts and pushes blood through the pulmonary semilunar valve to the pulmonary artery. The pulmonary artery then transports the blood to the lungs. Here you can see a capillary and an alveoli in close contact with each other. They both have thin enough membranes that it allows for easy gas exchange between the two, so the deoxygenated blood comes in, CO2 diffuses out into the alveoli, and oxygen diffuses in where it binds to hemoglobin in the red blood cells. And now we have oxygenated blood. The oxygenated blood returns to the heart via the pulmonary veins, and it flows into the left atrium. The left atrium contracts and pushes blood through the mitral valve. The left ventricle then contracts and pushes blood out of the heart into through the semilunar valve into the aorta. That's it for pulmonary circulation, so now we'll look at systemic circulation. It is via this process that tissues all over the body are able to receive the oxygen that they need and also get rid of their waste products. There are a whole bunch of different branches that the red blood cell can take in this circulation, but we'll only look at a few. So looking at flow out of the heart, it goes out via the ascending aorta, and then right away it can branch into either the left or the right coronary arteries. These arteries supply the heart tissue itself with oxygen. Then continuing up through the aortic arch, it branches first at the brachiocephalic trunk, which bifurcates into the right subclavian artery and the right common carotid artery. Then further on we have the left common carotid artery followed by the left subclavian artery. The common carotid arteries supply the head and neck with blood, while the subclavian artery supplies the upper limbs and some thoracic structures. If you continue on through the curve of the aortic arch, you reach the descending aorta, but we will first talk about blood supply to the head. So this has to do with the carotid arteries, as we mentioned. The right and the left carotid arteries branch into the external and internal carotid arteries, which supply external and internal skull tissues respectively, and this is responsible for getting blood and oxygen to the brain. Next is the thoracic wall blood flow. So we'll look at the subclavian artery here. Off of the subclavian artery branches the internal thoracic artery, which supplies the mammary gland and the anterior thoracic wall with the blood it needs. And then off of the internal thoracic artery branch the anterior intercostal arteries, which supply the anterior space between the first 6 ribs, and the musculophrenic artery, which supplies the space between the false ribs. We also have the posterior intercostal arteries, which branch from the supreme intercostal artery, which you can't see here, and they supply the posterior space between the first 6 ribs. For blood flow in thoracic organs, we have the lungs, which are supplied by 3 or 4 small bronchial arteries that branch from the descending thoracic aorta. We also have the esophagus, which is supplied by the esophageal arteries that branch from the descending thoracic aorta. And we also have diaphragm arteries, which include the superior phrenic arteries, musculophrenic, pericardiacophrenic, and inferior phrenic arteries. Now the descending abdominal aorta. So up to this point, we talked about the descending aorta, which is also called the descending thoracic aorta, but after this vessel passes through the diaphragm into the abdomen, it is renamed the descending abdominal aorta. At the level of the L4 vertebrae, this vessel bifurcates into the right and the left common iliac artery, which further branch into the internal and external iliac artery. The internal iliac artery supplies pelvic and perineal structures, while the external iliac artery supplies the lower limbs, which we'll talk more about in a minute. Now for abdominal wall blood flow, some arteries to be made aware of are the superior epigastric artery, which supplies blood to the superior abdominal wall, then the inferior epigastric artery, which supplies the lower part of the abdominal wall, and 5 lumbar arteries that branch off of the descending abdominal aorta, which supply the posterior lateral abdominal wall. For blood flow in abdominal organs, there are 3 paired arterial branches that come off of the descending abdominal aorta. These include the middle suprarenal artery, which supplies the adrenal gland, the renal artery, which supplies the kidneys, the gonadal artery, which supplies the gonads, and that's about it that we need to be concerned about. But the venous system is a bit different because though the right renal, right suprarenal, and the right gonadal vein all converge independently onto the inferior vena cava, the left suprarenal and the left gonadal vein converge on the left renal vein, which then itself converges on the inferior vena cava. So this is a bit different because it's not symmetrical, so it's just something to keep in mind. In terms of venous return in general, the name of the vein typically corresponds to the artery that it's close to, and like you can see here, there's the subclavian artery and the subclavian vein. They're a similar size and in a similar spot, and they supply / remove blood from similar areas. And all the veins in the heart ultimately, or all the veins in the body ultimately converge on the superior or the inferior vena cava, depending on where in the body it's coming from. An exception to this is the hepatic portal system. So this is the hepatic portal system, and it is strange because it receives the blood from 3 important veins from the GI tract: the inferior mesenteric vein, the superior mesenteric vein, and the splenic vein. They all come together to form the hepatic portal vein, which shuttles the blood off to the liver, where absorption of nutrients and toxins are going to happen from the blood. And then after this, it'll then go to the inferior vena cava, but it just has a little bypass that it does. Now for upper limb circulation. So as we said before, the main blood supply is the subclavian artery. It supplies the blood for the upper arm, the forearm, and the hand. The arterial system here is pretty complex, so we won't really get into it, but we will talk about the venous drainage. So we have superficial and we have deep venous drainage. For the superficial aspect, the hand has a dorsal venous network of veins that drain into the basilic vein and the cephalic vein, and these have branching that goes deeper into the musculature, which connects up with the deep venous drainage. So now we have deep venous drainage, and the digital veins and superficial and deep palmar venous arches drain into pairs of radial veins and ulnar veins that you can see here. There are also brachial veins here in the deep musculature. And all of these veins ultimately converge onto the brachiocephalic vein, which then sends the blood into the superior vena cava and into the heart, completing that systemic circulation. Now for lower limb circulation, the major artery that's kind of analogous to the subclavian artery would be the external iliac artery, and it gets renamed the femoral artery as it passes behind the inguinal ligament. For superficial venous drainage, the main ones to know is that the dorsal venous arch located on the dorsum of the foot drains into the great saphenous vein and the small saphenous vein. For deep venous drainage, the deep veins in the foot drain into pairs of medial and lateral plantar veins and pairs of the anterior tibial veins. The medial and lateral plantar veins and the fibular veins drain into a pair of posterior tibial veins, and then these anterior and posterior tibial veins merge to form a popliteal vein. And as if that isn't enough, the popliteal vein becomes the femoral vein, which becomes the external iliac vein, which becomes the common iliac vein, and then the 2 common iliac veins from either leg merge to become the inferior vena cava. So that is the end of our content, and then here are some questions for you to look at when you have time, and here are the answers that we came up with. And that is the end of our presentation. Thank you for listening.